Welcome. My name is Robert Tasker and I'm your Editor-in-Chief of Pediatric Critical Care Medicine. June 2022, another great issue for PCCM. My three editors' choices: an article by Rogers et al. On the time course of microbiome changes in patients with severe traumatic brain injury, a 5-center study with both index cases and controls. The second paper is by François et al. From Canada. This is a single-center prospective study addressing the question, do we still have a problem with blood volume discards when we're sampling? 423 patients in this study. And the third of my editor's choices is by Morris et al. This examines the question of whether or not the addition of lactate concentration adds to the utility of the Pediatric Index of Mortality, or PIM score. 33 PICUs in UK and ERA, 29 PICUs in Australia and New Zealand, over 60,000 patients in the analysis. Then we come to PCCM connections. Here I've put together 5 articles for you to do with hemodynamics and sepsis. The first 3 are hemodynamics. We have a concise clinical physiology review looking at modeling pressure volume loops and sepsis in 3 different scenarios, and the effect of adding various vasopressors and volume. So beautifully illustrated and well written. The second article is on vasoplegic shock in MIS-C and the characteristics of that. And the third article is about heart rate variability and biomarkers of inflammation. Then the 2 more conventional sepsis articles, one on augmented renal clearance of vancomycin in sepsis, and the last article on sepsis is our use of health resources in survivors of pediatric septic shock. When you've gotten through all of those, by all means look at the other articles, but I just want to highlight this month's PCCM narrative, which is entitled My View from the Other Side of the Bed. This is a moving piece when a pediatric provider, stroke carer, becomes a parent of one of the patients on the PICU. So all in all, great reads. Many thanks to our authors and reviewers. See you again in July.